Hello, everyone. Welcome to Series 3, Episode 3, 3 for 3, of the Eve Appeals online series, Probably Nothing. I'll introduce myself again, even though if some of you have been watching every week, you're probably sick of me repeating myself, but oh well, I get to do the intro. Sorry. My name is Karen, and I'm the Cancer Information Officer at the Eve Appeal. So I, along with our amazing gynae nurse Tracy, run the Ask Eve information service. And it's a free, informative expert service where anyone can contact us with any type of gynae cancer query. And the reason we started this show, Probably Nothing, back in June last year now, is because a lot of the time we get wonderful people contacting the service who are kind of apologising for getting in touch with us and, describing what they're concerned about, whether it's a worry over something or a potential symptom they're concerned about, and they'll often say, sorry to bother you, it's probably nothing but, and fortunately, most of the symptoms for the 5 gynae cancers will turn out to be, probably nothing, i.e., not cancer, something less serious. But sometimes, of course, for some people, that probably nothing is something. So we wanted to create this space that we can come online and I'll chat to a different expert every week about a different gynae cancer topic, and hopefully make this kind of informative, accessible, and kind of easy to understand gynae cancer information. So that's that. I think that's the quickest intro I've ever done. Normally I spend a lot longer talking about myself. So today we are going to be talking about the symptoms of cervical cancer and the sort of referral process if you go to your GP with symptoms. So the last 2 episodes, so series 3, episode 1, we spoke with the lovely Adriana from Joe Cervical Cancer Trust about what cervical screening is, because that was Cervical Cancer Prevention Week when we started Series 3. And last week I spoke to Anita Mitra, aka Gynae Geek, all about HPV. So do catch up on those episodes. They're on our channels if you would like to find out about cervical screening and HPV. But today, as I said, it's cervical cancer symptoms, what to do if you're worried, and the referral process and what happens at hospital. So I'll bring in my guest now. Now, I mentioned a gynae cancer nurse called Tracy, who I run the Ask Eve service with, and that's who I've got today. There she is. Hi, girlfriend.
Hi, Karen. Hello. Lovely to see you. I've just been chatting to the lovely Ben, who's behind the scenes looking after us. And he said to me, Tracy, could you move a bit out of the way of the window? So we've been having a bit of online chat, me and Ben. You might find me jiggling around in my chair because there's 2 windows in this room. So if the sun shines on me, I must have done something good. Working with you, darling, must be it. Lovely to be here.
That's first world problems, isn't it? If you're like, oh, I've just got 2 windows in this room, I don't know what to do. And I was telling Tracy just before we went on, I've stopped wearing face makeup. So I've drawn my eyebrows on, obviously, done a little mascara, because why wouldn't I? But I've given up on face makeup because nothing matters anymore. So we're falling apart, Tracy.
We are, Karen, but we're here to chat.
We're here to chat.
All ears. What do you want to talk to me about today then? Ask me some questions.
Okay, so as I said in the intro, and you better be listening if you weren't jiggling around, we've already spoken about cervical screening and HPV. So I want to talk to you today about what happens if someone has symptoms. So I've explained in the previous episodes, as have my amazing guests, that cervical screening, just to reiterate, even though we're not going to discuss cervical screening really, is not a diagnostic process. So if you have symptoms, we'll come on to that, you don't need a cervical screening, aka smear test. A smear test, cervical screening, is a kind of general screening test to check health of the cervix, see if there's high risk HPV and abnormal cells that could develop if left untreated. So the screening process is nothing to do with symptoms. So try and, like, when you're watching this, kind of try and think of them as separate. Screening is just sort of a regular check, and symptoms are a different scenario. So I want to talk to Tracy about symptoms. So we get this question loads, and I think this is a good place to start with this topic. So my daughter is 22 and bleeding after sex. Her GP is refusing to give her a smear test. What do I do?
Yeah, Karen, that's one we get a lot, isn't it? And actually, we need to break that into two. And let's do the last bit first. The GP refusing, and that's how it feels to the emotive mum, doesn't it? Refusing because it feels like you're not getting healthcare.
Yeah,
But
and
in
it
fact,
feels like they're putting up a barrier.
exactly.
Yeah.
But actually, what the GP is doing is the right thing. So we shouldn't be screening, aka the smear test, for any women and under the screening age, which you talked about before, so mid-20s. And the reason for that is we know that if we screen or do the smear test, same thing for the younger women, we're likely to get more false positives, and it's not a useful test. So the thing is so that's why the GP is not doing the smear test as a reaction to the symptoms that this mum's younger daughter has got. So she's in her early 20s.
Yeah.
So that's the right thing for the GP. Now, the right thing that the girl has done, the young woman, and the mum is worried about her, mid-20s, with her bleeding when she's not expecting it, is to go to the GP. The GP now needs to send this young woman to see a gynecologist to investigate why she's getting the bleeding. Before doing that, we would hope that the GP would do an internal examination, a gentle internal examination, after taking a history of when the bleeding occurred and how often, to try and elicit why the bleeding may be. So, for example, if this young woman is on the pill or has changed her pill, or has changed any of her contraceptive methods that might be hormonal, that may actually be causing the bleeding. So it's right for the GP not to offer a smear, although to the mum and the daughter it feels like being refused care. It's right for the GP to refer to the gynecologist after doing initial investigation and history. So that's the way we tend to do it, isn't it, Karen? We break it down.
And you said that when the young person who's bled after sex gets in touch with the GP, you would hope they would do an internal examination to see, if they can see anything. Because of I don't know if you've heard of this thing, Tracy. It's called the pandemic. It's kind of, I don't know, but would we? Because we know that GPs are. They keep saying they're still open for us, but obviously, for example, we've spoken about in the last couple of episodes of this series that people in some places are struggling to get their screening tests. Some people aren't, some people are. It's kind of luck of the draw at the moment. So we know that GPs are open because they keep telling us, but they obviously do have to sort of triage / prioritize, even though I hate the word prioritize when it comes to our healthcare. But in terms of appointments, obviously they have to prioritize more urgent appointments. So say I'm 22. Oh, I wish. And I'm bleeding after sex. And for example, I know from my older sister that my GP isn't doing cervical screening at the moment. Fine. That's just how it is at the moment. We have to keep trying. And if you are trying to get a cervical screening appointment, quick caveat, just keep contacting your GP. I know I've spoken about this before, because things change all the time at their practice. Their nurses that do the sample taking might be back from doing the vaccine 1 week. So just keep trying. Anyway, so my older sister can't get a cervical screening. Fine. So I think, right, well, I'm 22 and bleeding after sex. They're not doing screening. Then I realised from us lovely lot, I don't need screening. I need to talk to my GP. Should I expect during the pandemic to see my GP for this gentle internal, or would I expect a phone call and a referral without being seen?
So it's a really good question, actually, and it'll vary where you are in the country, because if we watch the news, we can see different healthcare pressures around the country. So one size doesn't fit all, but generally what I think our 22-year-old should expect in this instance is actually that the GP will take a good telephone history from her. And if she's not quite sure how to present that to the GP, she can always give you or me an email or a ring, Karen, and the details for Ask Eve will be at the end of your show. So that's always a given. So a really good history should be taken from the GP, and it is likely that the GP will say, is this a one-off? If this is a one-off bleed after sex, actually that's not uncommon. It could have been deep sex, it could have been fairly rough sex. It could have been, a different sort of condom that's been used that there could be an irritation with, all sorts of different reasons, because it is probably nothing, as you were saying at the top of the show, it is probably nothing. So if it's a one-off bleed, it is highly likely that the GP will say, and rightly so, will say, don't worry about it, 22-year-old Karen, we'll call her Karen if I may. But do keep an eye on it and let me know if this happens again. I think that is the likely and the right thing for the GP to do. The GP won't refer our 22-year-old Karen into the gynecologist simply because of the pressures, and also the gynecologist will want more information. A one-off bleed would not be enough to get you to gynae. So I think the thing is, it's having that dialogue with the GP. And that, again, is super stressful, isn't it, Karen? Because we've got our 22-year-old who's really, really worried.
Worrying, isn't she?
Yeah.
And
so that's where we come in, I think. But a one-off bleed, I don't think the GP at the moment, unless they've got a lot of capacity, which they don't have, will be seeing her. So it's about keeping a diary of her symptoms.
And say, say we're speaking to her through Ask Eve, and say you give them that answer, okay, well, if it was just the once, it's more likely to be all of these things than a sign of something serious going on, because it was just the once rather than this a cancer kind of causing a problem. Then I say to you as the 22-year-old, oh no, actually, Nurse Tracy, Ask Eve, who I've phoned, my bleeding's actually been going on every time I've had sex for the last 2 months. Then what? That changes things, right?
It certainly does. So then in that case, I would say to our 22-year-old Karen, okay, so your history has been persistent bleeding after sex for a couple of months. I think you should definitely go and see the GP and give the GP that information. Your GP is very likely to see you then. And if they don't, give us a ring and we'll encourage you and give you a sort of a dialogue to have with your GP to be seen. The other things that you and I would be saying to our 22-year-old is, okay, can you think of any other things that have changed in your well-being? And we're very careful, aren't we, not to say symptoms, because we don't want to put the fear of cancer into our 22-year-old's head, but we also want to support her and help her. So we would be saying, is there anything else that has changed? And rather than using the word symptoms, and we would go through, so do you wee the same as you used to? Do you feel any pressure when you're having a wee? Are there any changes there? Have you got any new aches or pains? Is there anything that you can describe? This is our 22-year-old Karen, that has changed in your bodily functions or in your well-being that you can think of that you could also add to the dialogue for your GP. Because sometimes things like changing in urinary habits, different pains, and that can be abdominal pain, that can be back pain, those can give us a little bit more of a clue as to whether or not there is something up with the cervix or concerns with the cervix. So that's what we would guide her to do.
And I think that's a really good time too, because we are talking about the symptoms. So for example, this 22-year-old, if she had bleeding consistently after sex, that's, again, it's probably not cancer, but it's kind of it's more, the time is more of the essence when investigating it than if it was a one-off bleed once after some sex. Can you so you obviously see people with all gynae cancers every day of the week because that's your job. Imagine if that wasn't her job and it was just a random fact. No. Can you tell me from kind of early stages, so I hate to talk about myself, Tracy, but my cervical cancer, the only symptom I had was the bleeding after sex and bleeding between periods, so bloody discharge a bit and then a lot of blood when I had penetrative sex. So that was my sign, and it was caught early because I only waited a few weeks to be seen by the doctor. From early all the way through to, I hate saying it, but like later diagnosis, because that's what the show's about, being really upfront and open with information. Can you describe to me the symptoms you've seen of cervical cancer, kind of whether it changes through the stages or just what that looks like from a nurse's perspective, someone's symptoms?
Yeah, so this is a general description because every woman is unique, aren't we?
Yeah.
I hope you've noted that, Ben, in the background there, who's looking after us. We are unique, us women.
We're
You guys
so
are all right.
special, Ben. Ben, we're
We're
so
absolutely
special.
wonderful. So, so poor Ben, you're looking after us really well there. So early symptoms, actually, for early cancers, early cervix cancers, usually symptom-less. So just to promote that, going for cervical screening, because that's the whole point of it. You're not likely to have any symptoms. So that's why you need to go for the screening. And I know Karen's talked about that in the last two shows, but that's really, really important. So very early, not likely to have any symptoms. A little bit further on, and still and very much within curable, treatable, manageable disease of cervix cancer, the postcoital or after sex bleeding, the in-between periods bleeding, or unexplained discharge, because we often say bleeding, and so we all tend to think of bleeding as that sort of what I call that Snow White moment, or that bright red on white, whether it's your panty liner that you're wearing or white knickers, if you've still got white knickers these days. Not many of us seem to wear them. It's much easier having black ones that don't go grubby in the washing machine, do they? You see, you do as well. Exactly.
No, I think I've got a few pairs of nude coloured knickers for, like if I'm being daring and wearing something that you might see a bit of my knicker through. I don't know why. Haven't done that for like over a year. I don't know why I've said that as my answer. But all of my pants are black. I don't think I own white pants because they just get. Because also, like, we've said discharge. I've said discharge. You said discharge. If you've got a vagina, you're gonna have discharge. And it's just easier admin if it's not like it just stains more on white knickers.
Absolutely, absolutely. So back to what's in your knickers or what's in any woman's knickers, that discharge, and as you said, discharge is normal. So if you're normal, hashtag know your own normal. All of us have got different discharges. I haven't got much of one now because I'm menopausal. You've got more of one, Karen, because you're not menopausal. Ben, I hope you're listening to this. The important thing is know your own discharge, know what it's like. It will change during the month if you're premenopausal. If you get a change in discharge, that's something to note. So that is something that sometimes we see with the earlier stages of a cervix cancer. So that's kind of like
so this is why it's good to track your periods and track your discharge, or kind of, if you notice that you have a slightly, like I definitely notice throughout the month, like my discharge smells stronger depending on where I am in my cycle, because I'm not on hormonal contraception, so I've just got kind of my normal, whatever normal is for me, cycle going. But so if it's good to note down what your own discharge is like normally throughout the month, what your own bleeding is like if you do have a bleed, because for example, I can imagine some people smelling the slightly stronger smell kind of and thinking, oh god, this is something really to panic about. Actually, I would probably notice it the last month if I was also on alert, so it's good to note it down anyway, isn't it, to be able to spot when it changes.
Exactly. So that's kind of like discharge, whether it's a bloody discharge, whether it's a change in discharge, and then other symptoms, a little bit more non-specific really. So sometimes we get a change in urinary habit. So as I was saying before with our 22-year-old Karen, is there any change in the way that she is weeing? Then she might feel a pressure in her back. So I've got my hands on my back here, sort of up, sort of just above my waistline. I do have a waistline, even though I'm menopausal. I'm not standing up because I've got my pajama bottoms on, everybody. There you are. I've outed myself.
Yeah, who cares?
Yeah. So that can be sort of like, that's sort of like lower to middle back pain. Sometimes cervix cancer can present with a kind of like a low pelvic pain, periody type pains. Most of those, I have to say, are really unlikely. And those pains are likely to be something else, either constipation, too much gardening, done too much home exercising in COVID lockdown times, and actually not got your posture right. So highly unlikely. But it's about any changes in your normal and reporting those to the GP.
So we've spoken about so the main signs are basically bleeding, and that includes a bit of like bloody discharge or unusual discharge. So change to your bleeding or discharge. So that for bleeding means bleeding when you're not expecting to. So sort of between periods, if you have them, after sex. Now, this kind of leads on to the next question, because we've mentioned bleeding between periods and after sex. We haven't, unlike when we've done other episodes in previous series on, for example, womb cancer, we speak a lot about postmenopausal bleeding when it comes to womb cancer. That's a kind of key, well, it's quite literally a red flag. We haven't mentioned that as much now here. Is that because someone's asking, is cervical cancer more common in younger people?
Yes. Cervical cancer, of the 5 gynae cancers, and we remind ourselves of those, so that's ovary, cervix, womb, vulva and vagina. Cervix cancer is predominantly the cancer that we see the younger group of women in. It doesn't mean that older women don't suffer from it. So it doesn't mean that older women can go, oh no, I don't need to go for my screening anymore. She does need to keep going. But it's predominantly, we see it in the younger age group. We don't tend to see it in the younger age group of the early 20s. We do see it sort of 30s, and in women of 40s, around 40s, very much so we do see it. And of course, Karen, your own story, how old were you when you were picked up?
I was 24.
Yeah,
but I
so
know that is rare. We do know that, and I don't want to scare people, but it happened.
Yeah, exactly. So it is the, of all the gynecological cancers, it is predominantly the younger woman.
Yeah. So if we had to put age brackets on all the gynae cancers, cervical would have the younger age bracket if we had to. But as you said, saying that, anyone can get the disease at any age. So if you aren't having periods anymore, i.e. you've gone through the menopause and you do have a bleed, whilst it's less likely to be cervical cancer than if someone at 30 has an unusual bleed, it could still be something cervical related. So don't think this doesn't apply to you if you're past the menopause. It's just more common in people who are still of menstruating age. So you've said, okay, someone else has asked, do you always have symptoms? And you've said in the early stages, very early stages, no. But once, so I was a late stage 1 and I did have symptoms. Is that kind of normal that I, at a late stage 1, did have the bleed? Or is it sort of lucky that at a late stage 1 I had a bleed that meant I went to the doctors?
I so love that you think you were lucky because you had a bleed, because you have cancer.
I
love working with your girlfriend. But yes, in answer to your question, no, you weren't lucky. Yes, it was lucky that, and the right thing that you did to go to your doctor. And yes, that genuinely is the situation where, for women at your stage, when you had your cancer, you would have expected to have experienced a bleed. The thing is yours was a frank bleed. The important thing, I think, we're still on discharge now, can't get away from it. I thought we'd finish, but we haven't.
Can't
discharge is really, really important.
Yeah,
sometimes it's just a change in discharge, or that kind of browny sort of gunky stuff that you get either before or just as a period is starting or just afterwards. That's often all a woman will see.
The end of my period. I definitely get that at the end of my period. That kind of lasts, you think you're fine, and then you just get a blob of brown gunk, and you think, oh, for God's sake.
Yeah. So often it can just be a bit of brown gunk that a woman will see, not that bright red. So it's really, really important. Any change, anything you're not sure about, just ask.
Someone is, so kind of going back to bleeding after sex. If I bleed after sex, is it likely that I have cervical cancer?
No, you probably don't.
Yeah.
You may well be on the pill, for example, and the pill can cause a non-cancerous situation called an cervical ectropion, and all that means is that the skin of the cervix, which is very friable anyway, so it's kind of like a medical way of saying fragile. I don't know why we have to medicalize everything. It's fragile sort of skin with lots of blood vessels. And actually, if you examine a woman with who's on the pill, who has an ectropion, what you can see, it looks very almost like literally cherry, to excuse the pun, cherry red, and that shows it's just the hormonal changes that come with using the pill, and during sex, that very, very sort of fragile area can get knocked either by a sex toy, finger, or penis, and that can cause bleeding, not cancer.
Okay.
Really common.
And okay, so regardless of what age, someone has got symptoms, their GP has said, okay, I'm going to refer you to the gynae. What actually happens? So we've spoken in previous episodes about how if you get an abnormal screening result, you'll go for a colposcopy, so a kind of a closer inspection of the cervix, I think is the easiest way to describe it. Does someone with cervical cancer symptoms, not an abnormal cervical screening result, do they still go for a colposcopy? Like if I've got symptoms rather than an abnormal screening result, I know I'm going to the gynae. How soon will I be seen? Who will I be seen by? And what on earth is going to happen?
Okay, that's a really good question, because it's not necessarily the same in every single hospital. But generally, a woman, let's call her 22-year-old Karen, and let's say her bleeding after sex has been, well, let's say that 2-month history. So she's been to see her GP's done a gentle examination, and they think they can see the ectropion, because let's have our 22-year-old Karen on the pill. GP's not sure. So the GP will send Karen in. Now GP might send Karen to colposcopy, or might send Karen to general gynae, depending on what the resources are at the local hospital. It is likely that our 22-year-old Karen will be seen in a colposcopy chair. In other words, she'll be asked to sit in the colposcopy chair. So that's where the gynecologist can, when she's got her knickers off and her legs open and a speculum put in, so that's that generally now plastic instrument that is put inside the vagina and then opened up. It's generally that done in the colposcopy chair is easier, because we can use a special light that we can look at the top of the vagina at the cervix. So it is likely she will be seen and asked to sit in a colposcopy chair, or couch is another way of putting it. So it's a bit like going for a colposcopy. And all colposcopy means is looking into the colpus, which is the space where the space of the vagina, looking at the top of the vagina. So that's likely to happen for the majority of women. For some hospitals, it may be that they don't have the colposcopy facilities, and all that means is they don't have that sort of chair. So in other words, she'd be lying on her back with her legs open, knickers off, and the same procedure. So it would be having a look. It would be a physical examination.
And what are they looking for? So if the GP refers someone for potential symptoms, is this because the GP thinks this person has cervical cancer, or is it because the GP can't rule it out? It's a specialist that has to do that. So yeah, kind of if my GP says, right, we're going to send you to the gynae, I would worry, and I did worry.
Yeah. So the GP is doing the right thing, because the GP is not 100% sure what they're looking at. Now, what the GP should be doing is, when the GP writes to the gynae, they will be saying, got 22-year-old Karen here. She's been on the pill for 3 years. I think what I'm looking at is a cervical ectropion. She's bleeding after sex. It's been going on a couple of months. When I look and examine, I really can't see anything that I'm worried about. However, for best practice, I just want to be sure. So, and if that's the case, that's what the GP should be telling our Karen. If the GP looks at the top, does the same situation and looks and goes, oh, I'm not sure if that's an ectropion, I think that might be cancer and I'm a bit worried, then the referral that the GP makes is slightly different, because that will be more urgent, and that will be called a 2-week wait. And the GP will be referring into gynae, but gynae oncology, not general gynae, and should be telling our 22-year-old Karen, do you know, I'm a little bit concerned, so I've sent you for an urgent appointment. So the difference will be the urgency of the appointment. And if it's an urgent 2-week wait, our GP should be telling Karen, the reason I'm doing this is because I think this might represent an early cancer. Does that make sense?
Yeah. So if the GP, upon taking history or upon examination, COVID dependent, we don't know, but if they are concerned, will refer to gynae oncology on a 2-week wait, because they are not unconvinced it isn't cancer. They're a little bit suspicious. And if they think, oh, this is so like every other cervical ectropion I've ever seen, it fits the picture, we'll get her looked at, but there's not the sense of urgency, then it's a general gynae referral, and that could be that, that's longer than 2 weeks, and that just depends on when, as soon as they can see. So I like to play devil's advocate with you, bit of role play. I would worry if I phoned my GP, had bleeding after sex, and my GP didn't refer me urgently, because I can imagine everyone that contacts us with this question or contacts their GP with these potential cervical cancer symptoms, and the GP says, oh, I'll send you for a general gynae referral, that could be a couple of months. That would stress me out so much, Tracy, because I'd be like, what if I'm one of the young people that does get cervical cancer? I have to say, your answer would stress me out. I would really hate that they wouldn't refer me urgently.
Yeah, and I totally get that. And in fact, we've had those sort of conversations through Ask Eve, and this is so tricky, isn't it? COVID or no COVID, because our patient Karen would get this answer, pandemic or no pandemic. It's ramped up massively because the triaging, as we say, and that prioritizing does mean that actually, unless we've got, in most cases, very, very frank sort of symptoms that are sort of giving red flags of this is cervix cancer, Karen is going to get this answer. And to be honest, there's no really easy answer with this, aside from if our young woman, or any other woman, I don't mean this in ages, she doesn't have to be 22, she might be 32, 42, 52. If she's not managing to cope and her health anxiety, which is completely natural in this situation, is not managing, then she needs to have that continued conversation with her GP. What I don't want to do is say, right, just keep annoying, and I don't mean it, annoying is the wrong word. I don't want you to feel like you're continually annoying your GP as a patient. If you're not handling it, you need to let them know. So totally get that one. There's no easy answer for this. Although what we need to remember is, once again, also looking at smear or screening history. So if she has had, if she's up to date with her smear, now of course that's not going to happen to our 22-year-old Karen, because she won't have started that. But if she's a woman who's up to date with her screening, then that will give her some reassurance. If she knows she's not HPV positive and isn't on a recall, so there's another thing. If she is up to date with her smears, her screening, and is HPV positive, then that's another thing that her GP will have on her records, and she will know as well. So that's another factor that we can take into account, because we know that women with HPV are positive are more likely, that's the precursor or the sort of promoter for starting an early cancer. So that will be taken into account when we're looking at her history. But there isn't a really easy answer to that stress, and that's where we come in.
And so to kind of end on, well, it's kind of a rubbish note to end on because it involves hospitals, but so say someone's at their referral, they're being examined by a gynae oncologist or at the colposcopy unit. What's the gynae looking for, and do they take a sample? Kind of what happens next, like patient in the chair, what happens?
Okay, so it's pretty much like the colposcopy, or can be the colposcopy experience. So it's an examination. The gynecologist or gynae oncologist, depending whether she's come through 2-week wait or she's come through what we call general gynae, they all talk to each other, by the way. It's not like this suited booted guy. No, they all talk to each other, and they all work within the same department. So, for example, I have a clinic this afternoon, and I'll be working with a gynae oncologist with gynecologists next door, and they often will sort of come in well, they stand 2 meters away and we talk through masks and all that malarkey at the moment, but we all talk to each other all the time.
Fine.
So don't feel that, you know, you're being segregated.
Yes.
So looking, the consultant, the doctor, will look at the cervix using either the colposcope, so that's sat in that couch, or just with a woman lying on her back, and they will have a look at the cervix. If the cervix looks abnormal, or is there is something they are concerned about, then one of two things can happen. They may take a biopsy there and then using a local anaesthetic. They may do what's called see and treat all in one go. So it may be an area of the cervix that looks as though there are some cells that are on their way to changing into an early change, a precancerous change. And so there can be treatment that can be done in the colposcopy chair there and then. Or they may do nothing other than have a look and then suggest coming back for a biopsy to be taken in a different format, i.e. under a light general anaesthetic. And the reason for these different permutations are on the theme, and depending exactly what they're looking at, how easy they think it would be to take a biopsy without causing the patient, who's the VIP in all of this, too much pain or distress. So that's why sometimes biopsies are done there and then. Sometimes they're done under a very light local anaesthetic. Sometimes the treatment can be done to sort of cauterize or freeze the cells, or to remove a small area of cells to prevent any further changes. So there are different things that can happen, and it's all done on assessment of what they're looking at, what the patient can tolerate or manage. And if we can do everything, especially in COVID days, in COVID times, we try to do everything in one go, but we'll never push a patient if it feels like too much. I hope that explains it, Karen.
Yeah, it really does. Thank you. Okay, so we are coming to the end of the show, where I wish I could just say, I'll see you at the pub, Tracy, but I can't. Unless that would be a break-in, and that'd be highly illegal. We're not going to do that. And we live in different cities, so it's a definite no. Can you please give us 3 kind of like takeaway tips or things to remember, or, you know, kind of call us, or, you know, three takeaway things for anyone watching when it comes to potential cervical cancer symptoms?
Yeah, so I guess know your own normal. So know your own normal discharge, know your own normal menstrual cycle. And as you said, Karen, track it, write it down. It's not obsessing. People used to say that was obsessing. It's not. It's just knowing your own normal. And that's good to know. And then report any changes. Don't fear the smear. Make sure that you do go for your screening. And have a look at our website. Have a look at our website and have a look at cervix signs and symptoms. Familiarize yourself with those. And if you've got any worries or concerns, number 4, because I never listen to what you ask,
No, you don't.
is give us a ring or an email. That's Karen and I think you're going to put up our details, Karen, and we'd love to hear from you. And we'd also love to hear any ideas you've got. Karen's the ideas girl. I just do what she tells me. So it's been lovely chatting to you, Karen. I miss you tons. It's January's over and we still can't go to the pub, as you say. It's just not fair, but eventually I'll come back up to London and we'll have a beer together.
Thank you, my darling. Thank you, Tracy.
Bye.
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 Oh, we used to see each other every week, and honestly, it was an absolute highlight of my job. But she's in Bristol saving lives. So thank you so much for watching Series 3, Episode 3 of Probably Nothing, which was all about the potential symptoms of cervical cancer and what to do if you're concerned. We'll be back next week at 6 o'clock on the 9th of February. How is it the 9th of February next week already? I do not know. But in the meantime, if you've got any type of gynae cancer question and want to talk to Tracy or myself, please do give us an email, nurse@eveappeal.org.uk. We're always there to listen and help. Thank you so much for watching. Stay safe.